Hey there, it's Dr. Justin Marchegiani. In today's video, we're going to keep on the gluten bandwagon here, okay? So last video we were talking about gluten sensitivity, and today we're going to just talk about why we should be avoiding gluten in general, even if you aren't so-called sensitive to it. I see a lot of patients and a lot of physicians that still say, you know, they put their patient on a gluten-free elimination diet. Their patient improves, and then they really kind of lax up and say, go for it, you know, introduce some of this every now and then. And you know what? Sometimes that can be enough to really derail the person, because just because you don't feel it, you still may have a leaky gut. And you may be managing your stress well, you may be on a really good anti-inflammatory adrenal program, you may have knocked out an infection, but you still may have those genes that could potentially predispose you to a leaky gut. Because if we're gluten sensitive, we're definitely going to be creating a leaky gut when we eat gluten. Again, only about 1% of the genotypes, 1% of the population out there has an HLA-DQ4 genotype. Again, watch the last video for more information, but HLA stands for human leukocyte antigen, and these are basically our different alleles. In this case, we have 9 different alleles. And again, 2 and 8 are going to be the celiac genes. 1 and 3, i.e. A1 and B1, are going to be our gluten-sensitive genes. And you can see 5 and 6 are under the umbrella of 1, and 7, 8, and 9 are under the umbrella of 3. So just so you can see that there. So a great percent of the population has genes for gluten sensitivity. Now there's more and more research that has come out even just this year. They did studies looking at celiac disease patients and non-celiac disease patients, and they found when they added gluten in and they measured, they used some different tissue sampling tests where they put electrodes through the tissue over a 120-minute period, but they found, essentially they found leaky gut or gastrointestinal permeability even with the non-celiac, non-gluten sensitive group, which really just shows me that gluten is going to be driving leaky gut. And I guarantee you, people that aren't celiac, right? These are the average persons walking around. They're just like anyone else. They think they can tolerate grains and they're eating it, and then when they're running the test on them, the biopsy, the electrophoresis, they're seeing their guts leaky. So I'm just really hesitant for doctors and patients making the mistake, thinking that they're better, thinking that they're on track. Yeah, how much gluten is enough? I don't know. That's a really great question. I'm always on the, I always err, I have an autoimmune thyroid condition, just for the record, so I always err on the side, if I'm going to cheat, I'm going to cheat with a clean, gluten-free food. Again, gluten-free does not necessarily mean gluten-free, because a lot of the gluten-free flours and foods are made with other cross-reactive grains. So it's still bad, but you gotta do your best to mitigate. Like a white rice flour is gonna be better, okay? Ideally, if I cheat, I try to use almond or coconut or plantain, things that are gonna be totally grain-free if possible. So if you're gonna cheat and you're gonna treat yourself, try to use a grain-free flour of some sort. That's kind of your best case scenario. Again, if you are gonna cheat, in general, try to make it gluten-free. At least avoid the wheat, barley, rye, and cross-contaminated or cross-exposed oat. So at least do that. I strongly recommend avoid against grains in general. I see too many patients that have a silent hidden autoimmune condition. They cut gluten out for 3, 4, 5 months. They add it back in and it's like, whew, the floodgates really just open up. And the reason why that happens is their immune cells, especially the basophils that make these mast cells, the mast cells are what accumulates histamine. And histamine is kind of a vasodilator. It helps to bring fluid in when we get exposed to an allergen. And when we avoid something for a while, that mast cell accumulates lots of histamine. And when we get exposed to that food, we get walloped with a wave of histamine and we really feel it. Again, the other mechanism really here at play is going to be at the fact that we just can't feel if we have leaky gut. So if we're this 4 here, we still may be driving, even though this genotype here, this HLA-DQ4 is supposedly immune to gluten, we still could be driving a little bit of leaky gut with the consumption of gluten. Again, Forget the leaky gut, forget the other things we just talked about regarding autoimmune conditions. Let's look at some other reasons why you'd want to cut out gluten. Well, off the bat, we know that people that cut gluten and grains out of their diet, they have an improvement in dysbiosis. So we see a shift in the gut flora, according to research, when people are eating lots of grains and we cut them out. So you go from celiac to a gluten-free, grain-free diet, we see an improvement in the amount of bad bacteria in their diet. So if here's the bad bacteria here, bad bacteria actually gets lighter while the good bacteria actually gets heavier. So we see an improvement in good bacteria. This is good. That's reversing dysbiosis. Next, we see grains having low nutrition. Well, we know it off the bat because there's been lots of panels and discussions about fortifying vitamins in grains because they're so nutrient poor. This is important because they're nutrient poor. Well, why don't we just exchange the grains for the greens, right? This is my G for G substitute here. Greens instead of grains. Again, you're going to find any nutrient in a grain, you're going to find it in a high quality green vegetable, in spinach, in kale. Gosh, add some grass-fed butter on there and you get better fat-soluble nutrient absorption. Totally the way to go. Sub greens instead of your grains. So low nutrition. And also, 70% of all antibiotics are used on animals. Right? We have lots of sick animals out there. That's why eating organic is so important. Well, guess what? If you're eating sick animals, well, what are the animals also eating? They're eating grains. Why are they eating grains? Because grains will fatten up the animal faster. Again, farmers are paid for by the weight of the animal, not by the health of the animal. So it's all quantity based, not quality based. And again, what are the grains? Well, the grains are going to have all of the low nutrition in them, right? So that when the cows eat them, cows typically eat grass, you get nutrient deficient meat, and then you also get all the grass and the vegetation around there is full of drugs too, because they reabsorb all of the antibiotics that come out in the cow's stool. So you get drugs, and more drugs. So you want to stay away. Dysbiosis, low nutrients, also toxins. Grains also have wheat germ agglutinin and lectin in there, and then wheat germ agglutinin when lectin combined, they are very, very inflammatory. So other reasons why you want to cut them out. Lectins can create gut inflammation and even potentially create malabsorption with certain minerals and nutrients. We also have phytates in the grains, which can be zinc and iron and mineral blockers. We need minerals to help buffer acidity from stress in our environment. Also, wheat germ agglutinin, like I also mentioned, is another inflammatory component of the grain. So it's not just about gluten, it's not just about leaky gut. It's about dysbiosis, it's about toxins, it's about low nutrition, and I also touch upon one more thing. Grains are the most fortified. And what are they fortified with? They're fortified with folic acid. And a good percent of the population has a SNP for the MTHFR reductase gene. So they're missing this particular, or they have this, they're heterozygous or homozygous. They have a SNP either for one or both of these genotypes. And these genotypes prevent the healthy metabolism of folic acid. So typically we metabolize folic acid into folate. 30 to 40% of people can't metabolize, if they have one SNP, they can't metabolize folic acid into folate, and they actually metabolize folic acid into dangerous cancer-causing metabolites. And again, if you have two of the SNPs, then there's about a 70% chance that you're not going to be able to metabolize folic acid into folate. So again, we really want to cut the grains out because the grains are very, very high in folic acid because we dump them in them because we think that we're doing a benefit to society by doing that to prevent birth defects and neural tube and cleft palates and spina bifida, right? But again, the food's nutrient poor to begin with. So lots of folic acid in there. We want to avoid that. Cut the artificial folic acid out. Take a look at your multivitamin. Make sure there's L-methylfolate or L-MTHF. You really want to make sure that the doctor you're with is prescribing a high quality supplement that has that on the back. Again, all of these supplements that I prescribe to all my patients, I cross-reference and check that there's no folic acid on top of it because I'm reading the research and I want to make sure my patients get the most cutting-edge information at their fingertips. Again, a lot of information of this video. Watch the first one on gluten sensitivity if you need to get your head around it a little bit more. If you're having a gut issue, or you're struggling getting off the grains, or you're struggling healing your gut, or healing an autoimmune condition like maybe a thyroid issue, reach out. We can talk a little bit deeper about the next steps that you got to make to address this. But this is the first step you should be making, and just really simple here: sub the grains for greens. Again, this is Dr. Justin signing off. Subscribe, get more videos here below. Thanks. Take care.